Very good afternoon. I think we've been discussing digital since the morning, right? How many of you in the audience have any association or investment in a health tech or are a digital health company? Okay, about 10, 12. Out of the 270, we have about a dozen, right? And some of them here. So we'd love to have some points from you, maybe if time permits. We've got a great panel here, let me tell you, and it's across all the different dimensions of what we call healthcare. And I think what would be good is, I don't know if any of you all have gone through what each of these entrepreneurs do, but maybe it'll be a good idea if we can go around and just introduce ourselves and our companies and maybe talk a little bit about it, right?
So in this space, we are the new kids on the block. We've just kind of taken our website live around 45 days ago, docprime.com. We come from the house of Policy Bazaar. That is a name that may be a bit more familiar. So essentially, the pitch is to digitize the access and discovery of healthcare and be the first port of call, kind of a digital family doctor, if you may, from where we then advise patients and help them take their healthcare journey. Essentially based around all your modern jargons of AI, ML, all that you keep hearing. But essentially the pitch is how do we provide free online consultation to every patient across this country for their entire life.
Ashish, one question I want to ask you, because it's a topic in most conferences, right, which is Ayushman Bharat. You know, the entire expectation which was there that insurance companies are going to play a big role in across states has been completely reversed, right? Many of the states are now going with their own trust-based model. And apart from one or two states, at least for now, we don't have insurance companies playing a role. Now, I know it's not directly maybe related to your business, but what's your take on the way insurance is really shaping up in India? Especially now with the government piece and the non-government private piece as well.
Yeah, so interesting. Insurance is a very, very interesting space because if you look at healthcare, almost majority of the insurance today is still group insurance, which is the company buying insurance for the individual employees or somebody else. Like in this case, if you want to say government as a body, it's not about individual people buying for themselves. That's a trend that's only started in the last, let's say, 5-7 years. So retail insurance is still a very, very small piece of the pie. And if you look at medical health care as an expense, still less than 2 to 3% of the medical bills are actually paid by retail health insurance. So insurance has a long way to go, which is why we remain very excited about the space because even with this small volumes, the unit economics of the business are quite good. And as people get more and more evolved, as they also reach that level of self-actualization in terms of having funds for their basic needs and now risk mitigation becoming a big part of their thought process, you will see people getting more and more risk averse, buying insurance, and the retail sector will continue to do. What schemes like Ayushman Bharat and any government initiative really does is it doesn't directly impact insurance the way you described in the sense that, you know, insurance companies being a large part of it. It almost never happens. What happens, however, is that the ecosystem builds. Now, if you look at medical care is still, unfortunately, a top 20 city phenomena in this country. You look at the number of doctors, you look at even if you look at a MedLife or you look at anybody, you know, where the most of the orders are coming from, it'll still be the top 10, 15, 20 cities. We can keep talking Bharat, we can keep doing all of that. I think initiatives like Ayushman Bharat, if they go out well, what they do is they start expanding into the non-top tier cities. And what happens is then ecosystem starts building there. And the moment the medical ecosystem builds there, then again insurance becomes pivotal to pay for that space. And I think that's what we expect. So if the ecosystem builds, I think insurance companies will come in and support the ecosystem strongly.
Right. And from your perspective, amongst this panel sitting here, and especially I'll draw upon Meena's business as well as Tushar's. Do you see insurance kind of working closer with both of these businesses?
Oh, absolutely, absolutely. You know, one of our big, I hope so at least, because if that doesn't happen, then we are in deep shit. But yeah, having said that, we do believe in it very, very seriously, because one of the big things to notice in insurance is not actually the disbursement of insurance or really selling it. That's one component. The other component is actually handling claims, and not just handling claims, handling claim frauds. And I think that's where a lot of thinking in the insurance sector has still been about 22 decades old. And as you get into modern technologies in terms of fingerprint scanning, in terms of just GeoIP location, in terms of facial recognition, whatever you may, that all has not really come into claim management. And I think that's a big piece that puts OPD at the back burner for health insurance. Because look, you've got a stent which is 1.5 lakhs. Insurance companies are willing to pay up to 6,000-7,000 rupees to ensure that that's not a fraudulent claim. But here, an average ticket size will be 1,500 bucks. Often there'll be many ticket sizes that are like 400, 500 rupee orders. Like, how do you do claim fraud protection for 400, 500 rupee orders? And that's where technology comes in. That's where digital comes in strongly. And if you can still keep the cost of claim management to 5-6%, which is the industry benchmark in large-scale inpatient healthcare, then why not? Then I think insurance will come in a big way.
Thanks for that, Shah. So I'll ask one last question to the panelists, and then we'll open it up. But if you were to invest in one digital health company, each of you, with a view that it has a great opportunity, what area would it be in?
For me, portability. For me, one of the biggest issues with healthcare is inertia, is the amount of effort it takes to go to a place that provides medical service and access that service. So anything I can do from my home is very, very welcome. And therefore, my investment, besides what we're doing here, would be companies that are focused on providing healthcare at home.